Right, so we will begin. So welcome to your Indian Head Massage course. And thank you for agreeing for me to video it today as part of my level 3 award in education, so that's lovely. So it's just a few things that I normally start with, a bit of housekeeping to begin with. So you already know where the toilet is, it's just down the corridor there. I usually set a few ground rules and feel free, we're going to have a look at them one by one, but if there's anything you want to add to them, then we can write it up there. So if you could make sure your mobile phones are on silent or switched off so there's no interruptions during the course, and then feel free to check them at the breaks, that would be brilliant. Respect, so it's sort of respecting one another, not just me as a teacher but actually one another. So when somebody else is talking, things like, you know, don't interrupt if you can help it, and then you have your chance to say something afterwards. And also respecting their point of view. Their point of view may be different to yours, and that's fine. You know, we're all here to learn and we learn off one another, and the idea is that we're all different, aren't we? We all have different ways of being and behaviour. Kindness, yeah, there's a lot of unkindness about at the moment, so it's about being kind to one another. Confidentiality, again, sometimes things get shared in, you know, when you're on a course. So should we just agree that, you know, if we do share anything personal, that we, in here, we don't go outside telling anybody else those little confidences that we might have shared. Note taking and handouts, you've got your manuals printed off, and I've also put some paper there for you to write on. There's pens available on the table as well. There's also the client consultation sheet, and there's also a large print routine reminder which is useful for when you're doing the Indian head massage later, and I'll probably pin one up on the wall as well while we do it, so you've got something to refer to. I'm not expecting you to be able to memorise it all today, you know, this is what doing your case studies is all about later. Loo breaks, we're all adults, if you need the loo, don't feel you've got to ask me, just, you know where it is, just go and as quietly as you can and come back again, okay? There's refreshments on the table, I put some water, we've already had a nice hot drink, and we'll have a break after about an hour or so, and we'll see if we want another cuppa, so keep ourselves refreshed today. And then just health and safety, if you see anything that's problematic about the place, obviously we've got our bags and things, it's just making sure that nobody else is going to trip over your bags and things like that. We're not in an office situation here, this is my home, so there's not going to be any fire alarms going off, but we have got smoke detectors, so if the smoke detector goes off I shall go and check it and see if we need to evacuate the property there, alright? So that's that little bit done. Is everybody happy with that? Is there anything you would like to add to it?
No, I don't think so.
That's good, lovely. We'll keep them up there because it just reminds ourselves. I'll quickly introduce myself. So I'm April, I'm a holistic therapist. I've been a holistic therapist since about 2004. I've been a Reiki master for a long time, which means that I teach Reiki healing as well. Today obviously is Indian head massage, that's what we're going to be concentrating on. So I do a variety of therapies: lymphatic drainage massage, Swedish massage, deep tissue massage, Indian head massage, reflexology, and the list goes on. So hopefully today what you're going to get in your practical is some of the skills and expertise that I've built up over the years. And probably, although we've got the routine in the manual, you'll probably find me adding a few extra bonus bits there, so that you can, you know, use what is useful to you. Alright, and so now I think you need to introduce yourselves, and I thought we'd have a little icebreaker, and I'll start off. So obviously introduce yourself, say what you're hoping to get from today, and tell us something about yourself that we might not know. An interesting fact. So you've got to put your thinking caps on now. So my interesting fact is I used to have a motorbike trike. And I only gave it up when I had a hip replacement a couple of years ago. But yeah, so people didn't sort of look at me and see biker, so it was quite unusual to see me on my motorbike trike, which was all covered with Celtic designs. And I miss it. I do miss it. But yeah, so that's my interesting fact. So who would like to start?
Oh, I don't know, I can't think of something interesting about myself.
The problem
Sure,
we've got
there must
is, so I'm Katie, and the problem we've got is that there probably isn't anything we don't know about each
Well,
other.
no, because we're very good friends.
So,
Yeah.
I am Katie. I'm a Reiki too.
Lovely.
So
yeah.
that's quite interesting, and I think this is gonna definitely benefit that.
Yes,
yeah. But I don't know. There's nothing that particularly more interesting than that at the moment. I'll think of something. If anything comes to me, I'll tell you.
That's all right. Yeah, that's fine. What about you then?
I don't know. What's interesting about me, Katie? I'm Courtney.
Yeah.
I'm hoping to get out of obviously learning how to do Indian head massage and do it professionally.
Yes.
I'd quite like to go into full massage eventually as well.
Lovely.
I don't really know anything interesting about me, to be honest.
I'm sure as the day goes on,
Yeah.
we're going to find some things out about one another. Probably it'll come out over lunch or
Yeah.
something like that. But that's lovely. So welcome, Courtney and Kate. That's great. So we have an objective for the day. What's the objective for the day? Well, I've put it up there. So the idea of the course, this is the practical part of your Indian head massage course today, and it's to carry out an Indian head massage safely to industry standards, enabling you to obtain insurance to treat clients. So we're not expecting you by the end of the day to know fully, as I've said, the routine of Indian head massage. You are going to be looking at your notes and I'll be reminding you, and that's absolutely fine. But by the end of today, you will have done an Indian head massage on one another, a full Indian head massage, and you'll actually be the first case study for one another. And at the end of the course, you'll go away and you'll do a further 4 case studies. The final one will be assessed by me. So you've got time to practice and get the routine under your belt and gain your confidence before you start acting, professionally on your clients. So I hope it's going to be a fun day. I'm sure it is. I normally try and make courses as fun as possible. Okay, so that's good. I'm going to go through now the structure of the day. So this morning we do very briefly, we're going to cover a little bit about the history of Indian head massage, the benefits of it, contraindications. Does anybody know what contraindications means?
When there's somebody might have an underlying issue or something outstanding that might affect your treatment on them and how you're going to carry it out.
Yeah, lovely. So any sort of situations arising where you think it might not be appropriate to give an Indian head massage to that person. Okay. Preparation. So we're going to talk about how to prepare the environment before you do your Indian head massage. That will take into account things like hygiene and environment and so on. Consultation, because we do in massage do quite a full consultation initially with the client. So you'll be doing a consult, because you're going to be one another's first case studies today. You'll be consulting with each other and doing it that way. And then after the practical consultation, depending on how the morning pans out, we might not feel ready for our break then. If we want to go on a bit longer, then I'll do a bit of a practical demonstration and then we'll go for a break. So at some point in the morning there will be a refreshment break. I'll show you the Indian head massage. We'll do 3 movements at a time so that we're breaking it up into easy sections for you, and then you copy me, so you do that. So you'll be practicing, and then in the afternoon after lunch we'll have practical sessions, so again you'll be going through the routine again and doing that, a full routine on one another. Bit of feedback and self-reflection, comfort break if we need one again. We'll see how the day pans out, and then we'll do some feedback and assessment, and there'll be questions and answers. So does that sound okay?
Sounds really good.
Now it's up to you how long we have for lunch. You needn't say now, have a little think about it as the morning pans on. If you just want half an hour and to finish a little bit earlier, that's fine. I wouldn't do 3/4 of an hour. You've brought your lunch with you, haven't you? So yeah, so that should be long enough really to have a little break, if that's okay. Good. Lovely. So, Indian head massage. It's thought to be thousands of years old. It's quite traditional in India, and what you find is that families will perform Indian head massages on one another, and things like weddings and things like that, quite often the groom and the bride will have an Indian head massage before their wedding, so nice and relaxing. The proper word for Indian head massage is champassage, and so you'll sometimes see it referred to as champassage or champassage, some people say it that way. And if you turn to page 3 in your manual, it just tells you, to say it's a very brief thing there on the history of it. But champi is where we get the term shampoo from in English. So it's derived from that Hindu word of champi, which is good. You're both in hairdressing, so there you are. That's where shampoo comes from. Okay. It relieves tension and headaches. There's lots of benefits for Indian head massage. A lot of people will just have it for relaxation, and that's absolutely fine. But sometimes people will come because they've got things like sinus congestion. When we do an Indian head massage, we're working on the head, neck and shoulders, and we do a little bit on the face as well. And the points that we're working around the face are the lymphatic drainage points. Okay. And so as we work on those very gently, what that helps to do is to get all that sinus congestion to drain, for the person to actually feel less congested. A lot of models like Indian head massage, you know, if they've got puffy eyes and things, because it reduces the puffiness around the eyes as well. It's obviously relaxing for your muscles, and we hold a lot of tension in our head and neck, you know, particularly when we get stressed, or if we're sat working at computers, or like you guys doing your hairdressing with your arms raised and so on, hair dryers and brushes. You know, we hold a lot of tension here around our neck and shoulders. So Indian head massage is brilliant for reducing that tension as well. It helps to remove waste products. I said a little bit about, you know, the removal of congestion. Well, again, you know, that's sort of the mucus that we get in and around. So any massage that we do basically helps to eliminate waste products in the body. It gets that lymph moving so that it can then be excreted out of the system. So it is good for that. Increases circulation to the skin and the tissues, and stimulates the lymphatic system, as I said. The lymph nodes underneath your skin, they're very close to the surface. So actually you don't have to work deep to do lymphatic drainage massage. If you're working on the muscles, you're working deeper, but you know, for the lymph, you're working quite superficially, really, and it relies on the movement of the body to flow. So lymph is quite a thick substance, and if you become dehydrated, then it can be even thicker and it gets harder to push through the body. So this is why we always say when we do a massage to somebody, you know, after you've had your massage, do drink plenty of water. So about 6 to 8 glasses a day is a recommended amount. Some people will drink more. You can drink too much, and what that does is we need all these different mineral salts in the body. Sometimes if you drink too much, you can actually deplete those mineral salts. So it's getting the level right. So about a jug a day like that, a couple of litres, 6 to 8 glasses is what it is. Good for headaches. So if you know anybody that suffers with headaches, Indian Head Massage is great for that. Also for migraines. If somebody's actually experiencing a migraine at the time, it may or may not help. So you'd want to check in with them, you know, if you did start it and actually it was making them feel worse, which it can do, because if you're feeling a bit nauseous and so on, probably it's best not to have the massage when you're having a full-blown migraine. But for some people, I saw a lady the other day who'd just got the start of a migraine and it helped to alleviate it and get rid of it. So you have to sometimes have to use your judgment and ask questions, you know. Also good for jaw ache. If you know anybody that sort of grinds their teeth when they get stressed.
That's interesting.
Yeah, or grinds their teeth in their sleep, a lot of people do. You get some tension here, which is around your mandible. And then what that leads to is tension here.
It's only temple.
Yeah, so sort of temporal mandibular syndrome it's called. So you sort of grinding your teeth, things become really tight, and you then start with a headache, you know. So great for that, and you'll see later on we do a little bit of work around the jaw and the face. We've already said about sinuses. But what about mental benefits? That's the other thing to think about. I mean, how do you feel? Have you had massage before? You both experienced massage?
I've had a massage, but not an Indian head massage.
Right. Okay. How did the massage make you feel?
Nice and relaxed, calm.
Yeah. Yeah. So again, it's not just the physical benefits when we do a massage. You know, the mental benefits are huge because it really relaxes the body. What it does is it reduces that fight and flight response. So, you know, when we get really stressed, our adrenals go into overdrive basically, and what happens is you start to feel panicky or anxious or what have you. It's your body going, oh, there's something going on here to be fearful about, worried about, and I might have to run or fight. Well, when you do a massage, your body goes into what we call the parasympathetic response, and you begin to relax and your breathing changes, you know, and it calms all of that down. So it sort of douses the fire, as it were, that's in your adrenals and really calms you down. So it puts you in a different frame of mind entirely. You know, you might come in quite stressed before your massage, but hopefully by the end of it, you leave feeling a different person, not just physically, you know, less achy, but actually, I feel much better emotionally as well. So a lot to be said for that. And the other thing is that you mentioned a little bit about Reiki, which is a form of energy healing. I find Indian head massage works really well with Reiki because it's another Eastern discipline. So we're not just doing massage with it, but we actually begin by connecting with that person and that person's energy, and it balances their energy field. You can talk about chakra and energy centres in the body as well, but what we do to begin with is we connect with the energy, and at the end of the Indian head massage we actually sweep the body down. So we're sweeping away any sort of negative energy that might be there. So on all levels, it's really, really good. Everybody happy with that so far?
Yeah.
If you turn to page 10 of the manual, you can actually see in the manual what it says about benefits. I think think I probably have covered them all. But you can see there, so it lifts feelings of depression and despondency, provides a general feeling of having been healed. Now that's one that I didn't say about actually, which is very relevant for you guys with hair in the hair industry, is that it says here provides relief from hair disorders associated with stress, alopecia, dandruff, psoriasis. So of course what you can do with an Indian head massage is you can either do it without oils or you can do it with. So you can actually massage the scalp with oils, or for yourselves you could use a deep conditioning treatment or something like that. So if somebody suffers with something like psoriasis, obviously you've got to think about how flared up it is at the time, but it can prevent it. So probably if it's in flare up you wouldn't, but you know, if it's something that they occasionally get flares up of, it can actually prevent it flaring up, and it can condition the scalp and moisturise the scalp and so on if they've got a very dry scalp, you know, things like dandruff. Alopecia, it's not necessarily saying that it's going to stop hair loss. I think that would be a stretch too far for us to say that, but it does increase the circulation, and circulation, good circulation to the scalp obviously improves the condition of your hair, as you know. So that's something to keep in mind. Okay. So what we're on to now is contraindications, and this is the conditions we said. I asked you, didn't we, what you thought it was. So where it may not be advisable to give Indian head massage. So there's some things, you have got a page there telling you a few things, but are there anything that immediately comes to mind to you guys? I guess with your hairdressing you probably already know some contraindications to working on people's hair. What would they be?
Like open wounds or any sort of sore skin lesions or anything like that?
Like you said, a flare up with psoriasis.
Yes. Yeah.
Or like
head lice as well.
Yes. Sometimes people have things that are contagious that we have to be careful about, or transferable, like you've said, the head lice. Yeah.
Or if they've had a bump when they've got a lump or something on their head.
Yeah.
So you've got to figure out if that's
Any
anything.
swelling or bruises. Yes. That are particularly unexplained. I mean, sometimes people can get cysts on their heads, can't they? And they're okay. You can sort of work around them, but not on them. But you do need to know what you're working with. So if somebody's got unexplained swelling like that, you'd want to get them to get it checked out, wouldn't you, with their doctor? Yes, it could be something more serious. For all we know, you know, we're not there to diagnose people, are we? So just having a little look. Well, it's interesting.
What about like hair loss? If they're going through like a...
Yeah, again,
with the tension and obviously the movement of the hair, would that affect it?
it could, in some ways, again, you'd need to use your judgment. Because for some people it might help, because it might stimulate the circulation. But I guess, you know, if their hair is coming out, probably not. You know, some of the movements we use are like hair tugs.
Okay.
So, you know, if you've got somebody who was prone to losing hair, you probably want to miss that movement out and maybe use some of the more gentler ones on them. So again, just using your judgment, and knowing what, you know, if you can find out why, if they know the reason for their hair loss. Obviously you also get people, if you're seeing guys and they're having an Indian head massage, they may have no hair, they might be bald, you know, so again that hair tugging movement you include, because there's nothing to but there's lots of other moves you can use. Yeah, we've already said about cuts and bruises.
How about frozen shoulders?
Frozen shoulders, it would be helpful
It would.
with, because any massage that is going to get some stimulation into the circulation is going to help with that. I mean, there will be things that they can't do, particularly with the frozen shoulder, but we don't in an Indian head massage like I do with some massage movements. You know, we're not raising their arms really like that in an Indian head massage. I think the most we do is sort of bring them up into a shoulder shrug. Get the right teeth in. Shoulder shrug. So, yeah, just yeah, anything like that, because it relieves tension. So, you know, you can do some nice moves around the neck and shoulder with your thumbs.
Okay.
Yeah. Okay. Yeah, very high or low blood pressure is another one. So you know, and it's not just elderly people that get high and low blood pressure. So when you do the consultation, you be checking with your client, you know, do they suffer from high or low blood pressure? Sometimes they do, and if they're on medication for it, you can say, is it well managed with the medication? And if they say yes, then you can probably still go ahead and give them a massage. But if it's not very well managed, it isn't that you can't give them a massage, it's more the fact of how it might affect them. So it obviously increases circulation. So on the one hand, it could increase their blood pressure, but it also relaxes. So it might lower their blood pressure, and you don't know how that particular person is going to be affected. So as an example, if I get somebody that comes along for massage and they suffer with low blood pressure, I'm always very careful to say to them, take your time getting up from the couch.
Yeah.
You know, because they could be lightheaded, and the last thing you want is for them to faint. So, I mean, these are sort of the worst scenarios, but they're all the things that you've got to keep in mind. So you get them to sit up very gently, take their time, give them some water, because that then helps to raise their blood pressure, because you're getting some fluids down there. And high blood pressure I don't worry so much about, because in my experience massage tends to relax people, so it'll probably lower it a bit if anything. I'm more worried about when somebody has low blood pressure, and you're not working hugely deeply with Indian head massage like you are with some massage therapies like deep tissue, where you work quite deep. So it's just a lot of, when we work with people, and you'll know yourself in hairdressing, is using your common sense, isn't it, really, and checking in with them all the time to see how they are. Yes, there's a few other things. So we've got heel osteoporosis and things like that, arthritis. Again, we've got it down as a don't, but actually in the real world of massage, again, it's more about using your judgment, because massage can really help to alleviate the muscle pain. When you're very tight with arthritis, your muscles get tight. We can't do anything about the joint being arthritic, but we can help ease the muscle around it and the muscle tension around it. But it's about remembering to work gently, because if somebody, for example, if you've got arthritic thumbs, you wouldn't want somebody putting a lot of pressure on your joint, because that would be painful. So it's about being very, very gentle, really. And things like the head rocking movements that we use in Indian head massage, you'll see later, you probably wouldn't do that with somebody. You'd want to make sure, you know, if they've got a bit of an arthritic neck, I have Indian head massage, you know, you want to make sure that they're well supported, so that, you know, they're not in an uncomfortable position when you're working on them, because that's obviously going to make them feel worse. We don't want them to feel worse, we want them to feel better. So again, it's just using that. Things like epilepsy, people who have seizures. So again, this is what the consultation form is all about.
Mm-hmm.
You know, if you find somebody suffers with epilepsy or seizures, it could trigger a seizure, you know, doing a massage on their heads. So that's probably one not to do it on, for sure. Yeah, okay. So it is interesting, when I first learned massage, and of course I can tell you this from years and years of experience, when I first learnt massage, and I don't know whether it was the same for you with your hairdressing, you can tell me in a minute, but they give you a big list of contraindications of when not to massage, and actually, in truth, if we followed every one of those to the letter, we wouldn't have any clients, because the majority of your clients have got something. So this is where the common sense comes in, really. If you're really concerned, or you're in doubt, if you're in doubt, don't. And the other thing to say is, if you're not sure, like we said, with swelling on the head, you'd ask them to speak to their doctor, and see if the doctor thinks it's appropriate and okay for them to have massage. And you can, in your manual here, there is actually a letter that you can send to their GP, or they can take to their GP, which just says, you know, he or she can fill it in and say it's okay. GPs are very busy people, and so it isn't always something you can do overnight, you know. And sometimes they do charge patients for doing stuff like that, medical reports, because it is extra to what they normally do. So just keep that in mind, but we should professionally be making sure that the client is okay to massage, because if you don't, if they have got a contraindication and you go ahead, you've got it on your consultation form, you've both signed it, and then something happens, you know, you are liable for that. So we do have to be cautious and careful. Okay. So that is good. Have there been any situations that in your work where you've had to refuse treatment to somebody?
Just usually head lice, isn't it? Yeah. Or if they've got
I've had it where they've got an open wound and they're wanting colour on their hair, and I've advised probably not.
Yes. Yeah.
That's it really, isn't it?
And how have they been with that? Have you had any issues with how they've responded to that?
I think, well, when it comes to something like head lice, people are a little bit embarrassed more than anything else. But other stuff, I think people trust your judgment, and then they trust what you're saying to be the right thing. So generally they're okay. Yeah.
And we can have some quite tricky situations when we're going through consultation with people and contraindications, and this isn't particularly a contraindication that I'm going to come up with now, but I have had experience of people coming for massage. Maybe they've been working on the farm or something like that, got a very physical job, and they come straight from work and they come in their work clothes, and really they could do with going and having a shower, you know, and actually from our point of view that's a hygiene issue, really, because they're bringing in things that could contaminate your therapy area and so on. It doesn't happen very often, but when it does, it's a tricky one to deal with, because as you say, there's that embarrassment thing. So it is about, you know, keeping it as professional as possible, and you know, in that circumstance, when I have had that, I have had to say it's a hygiene issue. It's an issue of, you know, I have to make sure that the therapy room is kept as free as possible from anything that might cross-contaminate or cause infection. So if you wouldn't mind, I'm very happy to see you, but if you could go home and have a shower, and then, you know, we'll rearrange your appointment for another time or whatever. You may not see them again, you might not, you know, but there are issues where you have to keep yourself safe as well.
Yeah, you've got to be professional.
Yeah, you've got to keep a professional boundary, haven't you?
Yes, yeah. So that's good. So, lovely. So far, so good. So what we're going to do now is we're going to talk a little bit about, we have touched on it a little bit, about consultation. Again, if you turn to page 14. So I know that when I come for a hairdressing appointment, there's usually been a consultation with me.
Yeah.
And initially you fill something in, don't you, and keep it on record. And we do the same thing, obviously, with massage. But what you're going to find possibly is that our forms are much more detailed for massage therapy clients. That's because there are so many health issues that could affect whether you give a massage or not, or what type of massage you give, what you leave out and what you add in and so on. So it's to take an accurate medical history. So what you can do is you can give your client a form to fill in themselves before the appointment, and then you obviously would look at it when you sat down with them. And if you've got any questions about anything you've put, that's when you would be doing your bit of investigation with them to check what's what. Because you do quite often have to go into further detail. And believe it or not, people do forget also to put things down.
I think if you do it like that, so it gives them time to really think, doesn't it? If you let them sit down and do it themselves.
Yeah. Now I tend to do mine the other way, is I tend to sit down and I tend to fill the form in with them, asking the questions, and then I get them to sign it at the end. So at the bottom, what they're actually signing is they're signing to say that's a true declaration of their health. That's really important for you as therapists, because we have to have our professional indemnity, public liability insurance and things like that, so you'll know yourself. If they've signed it as a true account, but they actually left out something that was really important, and then later on, after the treatment, they went on and had an issue and wanted to sue you, you could actually, that document could end up in court. So that's why you need to get, it sounds really quite frightening. It's never happened to me in all the years that I've worked as a therapist, touch wood. But it does, and it can happen, and we are, there are some people who make a career out of trying to get compensation out of professionals. So, you've got to really be careful about it. So we're taking a true account of the medical history, we're getting them to sign it. It's also not just signing to say it's a true declaration, but normally at the end of the form, if it isn't on there, it's something you can add, is to say that you have to keep the records for a certain amount of years. I think now mine are 10 years. It used to be 5. I think it's increased to 10, but you'll want to check with your insurer when you get insured for doing it. Just make sure. And then you let the client know that you are keeping those records. You have to for insurance purposes, but that you're keeping them confidentially. So when you're filling in this form again, have you heard GDPR? Have you heard that? Yeah. So it was a few years ago now, wasn't it? But it was quite a biggie then. And that means that we only keep the information that is relevant on the person. We shouldn't be keeping anything that isn't relevant to what we're doing. We shouldn't be keeping any third-party information. Having said that, we do ask for next of kin details.
Yeah.
And that's a safety thing. So we do have to have that. But again, we wouldn't be sharing that third party's information with anybody else. Again, unless we had to, for health and safety reasons, we've got good reason for doing it. If the ambulance service needed to know or something like that, then obviously we'd do that. But you have to be able to justify why you've shared something. otherwise you're in big trouble. And we wouldn't share our clients' details with anybody else, again without their permission. So again, sometimes we might say, look, actually, it would be really helpful if I could sort of write to your GP about this and let them know what I've been doing with you and see if they're happy for me to do this. But again, we wouldn't write to their GP without their consent. Can you think of any situations in which you would share something that...
Or if something happened during the treatment and you had to call like an emergency service or something like that, and then you could share if it was relevant to what had happened.
Yeah. Are there any other situations?
I wouldn't think so, no.
The only other ones that come to mind for me is if you think that somebody is in danger.
Okay.
Yeah.
So if you think that they're a danger to themselves,
Yeah.
or a danger to others,
Yeah.
then again you can break confidentiality for those reasons. And you would normally, you know, if you're being line managed, speak to your manager. If you're not being line managed for somebody like me, I'm a lone worker, then I have to make that decision, you know. Am I reporting this? Am I going to the police with this? Because I do think it's a concern, you know. But I've got to be able to justify it, you know. So just keeping that in mind. Yes, so we were talking about contraindications, weren't we, and consultation. You just asked a question.
So when I noticed on the form it said diabetes could be a contraindication. I just wondered what that meant.
Yeah, so it could be that their skin is compromised with diabetes, and more often than not, it tends to be their feet that become an issue with diabetes. It's quite a lot of people with diabetes see a chiropodist or a podiatrist on a regular basis to care for their feet. So yeah, it's that the skin can break and be compromised. So you check, you know, you obviously ask the question, but then just check and see, ask them, you know, how's your skin, if you had any issues with your skin, and like you do in your hairdressing, you know, you'd be checking the condition of the scalp before you worked on them. So it's again, it's down as a contraindication. But again, I have clients for massage that do have diabetes, but if they've got issues, started to have issues with their feet, I certainly wouldn't be touching those, the broken skin or anything like that, going near any of that. So it really is using your common sense again, asking the right questions.
There's also a page on pregnancy.
Yes.
Is there something that you need to...
No, there's a little bit of conflicting information I noticed in the manual, which isn't helpful when you're learning something new, is it? So I would always say to be on the safe side, particularly when you're starting with your massage as a professional, it's probably best to avoid doing massage in the first 3 months. Now that isn't because there's any evidence particularly that it's caused somebody to have a miscarriage, but miscarriages do happen in the first trimester. It's more of a risk, and therefore you could have an issue where you've done a massage on a client, the next day she miscarries, and she's immediately going to think, is it that massage I had yesterday? You know, she's going to be questioning that, like we all do. Is it because I rode that bicycle? You know, is it because I did this? Is it because I did that? And then you're possibly left in that difficult situation because you can't say one way or another whether it was. But there has been no evidence to prove it. And again, in my experience, people who are pregnant really, it helps you relax. It's good for reducing the stress in your body and so on. But yeah, maybe to err on the side of caution is avoid the first 3 months and then get them to come back. after that, and they'd really benefit as well. You know, they'll probably have started to get a little bit achy after that, and so on, and a bit stressed out about things. So yeah.
So you know, you can get the Indian Head, like, well, just massage chairs with a bit of face in.
Yes.
How would it work for somebody that's pregnant?
Yeah, you can. Normally with Indian head massage, we just treat them sitting on a normal chair. And in fact, that's what I'm going to show you today. I will show you a massage seat, which is useful for somebody perhaps who isn't pregnant, but anybody who has issues with kneeling or issues, you know, with breast area or tummy, possibly wouldn't find a massage chair very comfortable. They'd probably be better sat on a normal chair. The important thing is that you can reach their neck and shoulders and their back to do the massage moves. So yeah, a comfy chair really with a low back on it is the best thing. The other thing we do in a consultation, just going back to consultation, is clients' wishes, you know, what they're hoping to get from their treatment. Yeah, so you're asking that. You're making sure it's safe to go ahead. You're looking for any areas, like we said, where there may be special care needed and more observation by yourself or more questions. And in doing that consultation, you're building the rapport and the trust with the person. They might not have been to see you before, or they haven't been for a long time, you know. So again, you're just building that trust and rapport up with the client. And you can also answer their queries. So they're not just answering your queries, it's an opportunity for them to ask you. So, okay. So I think what we'll do is, if you can get your consultation forms out, so I did print you off a couple, so it says case study consultation forms. It should be in your pile of things there, Courtney. Yeah. Are there any questions so far before I ask you to do this exercise?
Nope.
Alright, lovely. If things do come up later on, feel free to ask me. What we're going to do now is I'm going to get you actually to do a consultation with one another. And for the purposes of this, I think it probably would be useful if you are asking your client the questions. So you can decide who's going to go first, and then the second one can do it next. And I will just keep an eye and chip in if there's anything, or if you've got any questions as you're going through it, please just ask me, because it's your opportunity to see what it's like to fill these in. It's literally just the first 2 pages you're doing at the moment. And then you'll see there's also attached there is a feedback form for when you've done the treatment, for your client's feedback, and there's also a page for your self-reflection, because whenever we do practice and we're learning something, what we want to do is reflect on how it went, how it felt for you. So that's going to be the next exercise. So we'll do that, and then when we've done that, we'll decide whether we want another hot drink break, and then I'll demo the Indian head massage to you before lunch. Okay.
Can I just ask, it might sound ridiculous, but it says here, examples of contraindications that may prevent treatment. It says like broken skin and stuff. Is this just going to be, I mean, obviously if they've got a cut on their arm, the lower, well maybe, I don't know if you go down as far as on your leg or something.
Yeah.
Are they going to say that, or are you just talking about literally the area you're working on?
I normally ask if people have got any recent cuts or bruises or abrasions and things like that, and sometimes they might say to me, oh, I've got a bruise on my leg at the moment, and I'll say, well, what I'll do is I'll be avoiding that area, you know, if I'm doing a body massage. Bit different with an Indian head massage, because as you say, you are just doing their head, neck, scalp, and their upper back. You will go down the top of the arms a little bit as well. So if they say, oh yeah, I've got, you know, I've had a tattoo on my thigh or something, obviously you can say, oh well, okay, that's great, but I'm obviously not going to be working on that area today, so it's not relevant. But you know, if you were doing other therapies, next time they come back, maybe they've booked a full body massage.
Yeah.
You know, you'd want to be looking at your records and saying, well, how long is it since I've seen you? Is that tattoo healed yet? You know?
Yeah.
So it's useful to have that information there, particularly if you are offering other therapies later on. So nothing is, it might be irrelevant to the treatment you're doing today, but it might be very relevant to something you're doing later on. Yeah.
And so what if, as well, if you're going to ask these questions, but maybe they might have something on their head, obviously because it's under your hair, you don't notice, but
yes.
So then you notice it after.
Yeah, again, I have had that when I've been massaging on people. I've seen that they've got a bruise that they didn't know about. Then you're going to draw that to their attention as you're working on them, or you're having a look before you start work. You'd have your normal conversation about, I notice that actually you have got a cut on your head there. What I can do, it's only a small one, what I can do is try and avoid that area and work the rest of the area. If maybe you were going to use oils or something like that, then you'd be saying, we'll just do a dry Indian head massage and I won't use the oils I was going to use on you.
So would you come back to your form then and make a note of that?
Make a note.
Yeah.
Yes, make a note. And I've done it quite often with bruises because, again, I'm about to give them a massage. If they don't know about that bruise and I don't mention it, and they go home and their partner says, oh, you've got a bruise on your back there, massage therapist must have done it. You know,
Yeah.
So always mention it.
Yeah.
You know, have that discussion with them. All right.
Mm-hmm.
So lovely. So that's all good. So we're going to go on to that, and I'll come round and check how you're doing. So make a start asking one another question.